Facebook Live and YouTube Live. So this is a nice lady, 54 years of age, from the Northeast, comes in with what is a very classic capsular contracture on the right and also on the left. Her implants were placed just 5 years ago. So 54-year-old female, 2000 silicone implant below the muscle. So I did remove some of the excess skin for the contouring. The distance from the nipple all the way down to the crease is 5 centimeters on both. Now the first thing I want you to see, she went to a very prominent plastic surgeon in her hometown, and she was told she does not have capsular contracture. Clearly, 100% black and white. This is a capsular contracture on exam, clinical exam, and we can see that's reproduced right here. So this is that inflamed tissue that was on the periphery that I removed. This includes the fascia of the serratus anterior, by the way. And you can see how well this is kind of suffocated in. You can see these streaks right here, consistent with the contracture. As opposed to the left side, grade 3 capsular contracture, you can see these bands, but this is more round. But here is another part, and this was much worse on the left side capsular contracture than on the right. And you can see the right here looks worse. So what I'm going to do now is I'm going to go ahead and cut this open. And this was indeed what is below the muscle. You can see the fascia of that. This is the cartilage part of the rib. Just one second. I'm going to, Dr. Omar, if you can just zero my headlight. I'm just going to turn my headlight off so that way you can see. So if you look carefully over here, this is the cartilage part of the rib right here, and so all of that bad inflamed tissue has been removed, so there's no second guessing the process. And now what I'm going to do is I'm going to cut here. Remember, these are just 5 years old set of implants. You can actually hear this being cut. This was, you can see, look how it is kind of wrapped up on itself, the contracture, how it is folded up on itself. And it's going to essentially unwind and it's going to flatten out. So let's go ahead and cut this. Entirety of the implant capsule. You can see how transparent thin this capsule is. Yes, even if it's transparent thin, it cannot be cauterized. And so look at how it's sitting, right? It's bunched up. It looks like a brain, if you will. So I'm going to separate this, and you can see a small amount of fluid, not uncommon. Implant, literally, I would say in brand new condition. You can see some fluid. None of this spilled into the side. And if you look at this fluid, it's not enough to send. If I go like this, you can see it has this viscous consistency to it. It's like jello, and look at how it flattens out. And you can see right here, some areas so thin, you can see my glove right here. Some areas even thinner, some areas thick. But no matter what, the entirety of the implant capsule, all completely, sincerely removed. This patient had done a lot of research, had literally, I would say, memorized my videos, and very typical patient of mine. And so this tells you the entirety of the implant capsule removed. And this is your elegant 485. She was saying in the 300. And you can still see the contracture band right here, right in the middle. Even when I flattened it out, you will see because it was bunched up like this. And just 5-year-old set of implants. Now I'm going to remove my top glove. We're going to go over to the left side. So sterile gloves. Again, you have to have the appropriate patient markers and no HIPAA violation here. So I removed what is a left chest mass. And as you will see, I'm going to go ahead and dissect this open first, in case there is any rupture or fluid or anything. God knows what is inside. So see this mass right here? I'm going to cut. This looks like a pathologic lymph node grossly. So I'm going to cut right in the middle. And lo and behold, it has suggestions of what is a lymph node. And we'll see, it is large, it's big. It's the size of like 5 pea-sized masses kind of together, this ball right here. And so this fatty tissue was incorporated so that we can get a good representative sample. You can see the bovie mark. Now what I'm going to do here is, so this is the left side. This is the done in en bloc fashion. Total capsulectomy, en bloc, as you can see, en bloc on this side. Complete total capsule removal. You can see the imprint of the marker here. Very thin areas, some areas thick. And now I am going to cut here. This is your 485 Allergan as well. So no fluid around. 485, you can see some, look at this, it's leaching of that silicone, even from what would be a brand new appearing intact implant. 485. And you can see there's no lines in the middle, even though this was the worst contracted site, and capsule that's thinner. And again, the whole goal here is to show, even though how thin the capsule is, complete removal of the entire implant capsule. So the left chest will be sent, the left chest mass will be sent separately to pathology. Number 2, right and left breast implant capsules to be sent to pathology to rule out that rare BIL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures for aerobic, anaerobic, and fungal. Implants will be returned to the patient. And then most importantly, we'll see how the patient does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgery.